Order. End of question time. The clerk will now proceed to read the order of the day.
Item 1, resumption of the Committee of Supply to consider the estimates for the financial year 1st April 2019 to 31st March 2020.
Head I, Ministry of Social and Family Development. The question is that the total sum to be allocated for Head I of the estimates be reduced by $100. Minister Desmond Lee.
Mr. Chairman, I'd like to thank members for their thoughtful speeches yesterday evening. MSF will focus on 3 priority areas. First, building a strong social compact by strengthening family and community bonds and our collective resilience. Second, building a more inclusive society to enable people of all abilities to achieve their fullest potential. My colleague, M.S. Sam Tan, will share more later. And third, giving our children a good start in life through affordable, accessible and quality preschool. My colleague, SPS Faisal Ibrahim, will speak on this when he's later. So our social compact has evolved over the years. In the early days, there was a strong emphasis on self-reliance. Social assistance was minimal and community support ground up. As our economy developed, we experienced uneven income growth. We then introduced targeted social policies to give more support to those with less and placed stronger emphasis on collective responsibility and the need for many helping hands. As we face more challenges, an aging population, shrinking family sizes, economic disruption and so on, individual and family efforts may sometimes not be enough. And so over the last decade, we have shifted the balance decisively, with the government and community shouldering a heavier responsibility. We now have broad-based transfers and subsidies that benefit the majority, as well as more targeted assistance for the low-income, vulnerable, and those with specific needs. We've put in place trampolines to help people bounce back, the words of DPM Tharman, and social safety nets for those who cannot care for themselves and who have little or no family support. But even as our broad-based policies and schemes and our targeted means-tested support continue to uplift many low-income families, we need to do more to better support families who are bogged down by complex and often interlocking challenges. For such families, the consuming nature of their difficulties, addiction, incarceration, family violence, illness, divorce, mental health challenges, and so on, and often a combination of a number of the aforementioned, may make it difficult for them to access available opportunities, benefit from schemes and programs, or respond effectively to help that is offered to them. I know of a 4-generation family, teenage girl raised by a grandmother. She dropped out of school, had a son out of wedlock a few years ago in lower secondary. The girl's son did not have any preschool education until recently when services intervened. Why is this girl looked after by grandmother? Because the mother has been in and out of prison for various offences, out for a while, and now in for a long-term sentence for a serious crime. Father remained uncontactable for some time now and refuses to take responsibility for the family. And unfortunately, grandmother showing signs of dementia. So this is a family that faces very complex challenges, which makes it difficult for them to cope on their own, despite many agencies and VWOs coming in to assist in different areas. So the question is, how can we support such families with their existing needs and also ensure their next generation has a good start in life? At COS last year, I shared that MSF would be partnering and working with other agencies and community groups to transform and integrate our social services and strengthen that important last-mile support for families, especially those with very complex difficulties, so that help can be provided in a more comprehensive, convenient and coordinated manner. Ms. Denise Phua and Mr. Sia Kemping asked about our progress. At the joint segment on opportunity yesterday, I described the comlink that we'll be setting up to support rental housing families and the local community network pilot to wrap around support for at-risk youth and their families. MOE has also articulated the uplift proposals to support students whose performance and absenteeism are worrying. Now, all of these that we announced yesterday carry the DNA of integration and coordination, a different way of doing things in the social services. So let me now give this House an update on our broader level work across the entire social sector, and this is, in a way, an interim report card. Mr. Chairman, in the course of the presentation, may I display some slides on the screen for members' better understanding? Thank you. Sir, at the center is a family with complex challenges, like the kind that I described earlier. They sometimes face issues beyond those that they are seeking help from. For example, if a family seeks help from HDB because of HDB rental arrears, it could be because a breadwinner has lost his job and the family is in financial difficulty, hence running into difficulties with arrears. We want to ensure that these families get the necessary information and referrals to the relevant agency's services, regardless of which agency they first approach in the community. So even if they approach only HDB in the first instance and it's in relation to arrears, when the officer speaks to the family and understands that actually it is because of this and that, and although it's beyond my remit and I assess you for assistance on arrears, what they ought to be doing is to refer the family to, say, Workforce Singapore or E2I to help the breadwinner with potential job matching, and also to the SSO for financial assistance in the meantime. So we want each frontline agency in the community to be a potential gateway for families with complex needs to receive assistance from other social services, including those in the community. By the end of this year, we will train 2,500 officers from various frontline agencies to identify a client's broader needs and link the client to the relevant agencies. They include our frontline colleagues from the People's Association, HDB, Workforce Singapore, NTUC's E2I, the Singapore Police Force, Singapore Prison Service, the Silver Generation Office, and the Agency for Integrated Care. Over time, we will expand to include more ground agencies, as well as VWOs and community partners. Next, because the solution to families' problems may rest with multiple agencies, one needs to make some adjustments before the other can give approval. Families also need to travel to multiple touch points. And clients with complex problems are often asked to submit multiple documents or repeat their circumstances when they need help. We should not let this be a barrier to them seeking assistance. We have therefore established a single touch point where they can access multiple services, and we will start with the SSO. Some of our SSOs are already physically co-located with complementary services such as employment assistance and family services. We are using technology as well to provide some of these services via video conferencing link, and you can see that on screen. An SSO officer working with the client, addressing the assistance that the SSO can provide, but also linking the client through video conference to officers in other agencies so that there's direct face-to-face contact. And if documents need to be shared, we can send it across. By the end of this year, clients will be able to access financial, employment, and housing services at all our 24 SSOs, either through physical co-location of services or through video conferencing links with HDB, Workforce Singapore, and the E2I career coaches. By the second quarter of this year, clients will be able to access legal advisory services through video conferencing at Boon Lay, Taman Jurong, and Queenstown SSOs. And this is part of a pilot that we're trying out with the Legal Aid Bureau. We also observed that because agencies and VWOs are currently approached separately for specific issues, family will approach HDB for housing-related concerns, approach SP Power services for utilities issues, approach other departments for specific areas of need. These agencies sometimes end up with a compartmentalized understanding of the family's challenges rather than a holistic overview. And to address this, we are improving information and data sharing across agencies. We have established protocols with HDB and MOE. Why? To enable ComCare clients to be automatically considered for reduced HDB rental rates and assessed concurrently for MOE's financial assistance scheme for their school-going children. By the second half of this year, ComCare clients with young children will be automatically assessed for childcare subsidy and financial assistance. And this is work in progress, and we'll continue to expand these arrangements to more agencies. We are also using data and system interfaces to provide more coordinated and targeted assistance, especially if it can allow us to intervene early. I agree with Ms. Tin Pei Ling that data can be used to tailor assistance to clients' needs. SSOs and family service centers, for example, use SSNet or Social Service Net to share client information with consent, and we are looking at the possibility of more information link-ups. Beyond systems and data sharing, there needs to be careful case coordination so that no Singaporean falls through the cracks. I assure Mr. Darryl David that our SSO officers will work closely with the family and other agencies to understand the family's circumstances and support them holistically. But we take his feedback and will seek to do better. At the same time, we need to better organize and coordinate all of this work, especially when so many agencies and VWOs may sometimes be involved in certain families' cases, so that families can achieve the best outcomes. We are therefore introducing a set of case coordination guidelines for agencies and caseworkers across the community. Agencies will discuss and coordinate around the needs of families with complex challenges, with one agency maintaining overall oversight of each complex case. We call these guidelines for Case Master Action Planning, or case maps for short. The case map will guide agencies and caseworkers from different organizations, both within and outside government, so that they share a common understanding on the ground of the entire family's needs and align their interventions accordingly. And if they identify barriers, gaps, roadblocks, or inconsistencies in policies, criteria, or operational implementation, these will be surfaced to the relevant ministries through our SSOs to be looked into and resolved. About 200 agencies and 400 officers across 7 towns are being trained in these guidelines, which we have started rolling out from this month. The initiatives I've shared will strengthen our social service architecture and enhance the support which families with complex challenges receive. But going beyond systems, data, and protocols, what we are really working towards is a strong interpersonal network comprising our officers, social workers, and partners across various agencies in every town embedded amongst our communities. Our fellow residents, our VWOs, our partners on the ground know the local community and their needs best, and what local informal resources are also available to supplement formal support. Just imagine a map, each and every town in Singapore, covering the whole island. And on this map, you can see many, many dots, and each dot, from a planner's point of view, is a healthcare institution, a service center, an SSO, a school, a polyclinic, all embedded in the town. And each of these is like a node that we seek to connect through the SG Cares community network. And these community networks seek to share and tap on the collective knowledge of the community's needs, explore collaborations to make a greater impact, and to align and organize our efforts to better support individuals and families in need. So since May last year, we have started bringing together government agencies, VWOs, and community partners at the town level. Not at headquarters, but on the ground, the people who are actually running the centers in the communities. The first round of networking, involving about 160 agencies and 200 officers per town, will be completed by July this year. And the second round for some towns will start taking place from later this year. So we'll do this every year. But as a follow-up, the SSOs will, in between each of these sessions, lead deep dives with relevant partners to tackle specific social issues, such as youth offending, disability, the needs of seniors in that specific locality. They will also create more opportunities for our ground officers to build professional people-to-people relationships with counterparts in other agencies and VWOs. Because when you talk about systems theory, you talk about silos, you talk about people guarding their turf, what better way to address this on the ground than to let officers meet each other and know that actually you're all aligned to the same purpose, the same families you're serving, and let's work together. And we are already seeing positive outcomes from the networking. Project Home Alone, for example, is an initiative that sprung up from the Aokang Serangoon SG Cares Community Network session in September last year. The SSO at Aokang, the Ang Mo Kio Community Grassroots, and the Xingming Secondary School initiated an elderly befriending program after they met during this session. And it started last month. Secondary school students are befriending elderly residents living near the school, as well as in Tai Wah Kwan Nursing Home in Aokang. We hope to see many more such partnerships. A strong network of support within the community is crucial for those who need more help. And so Community Link or ComLink and the localized community network pilot, which I announced yesterday, will complement and strengthen support for the vulnerable. So imagine each and every town having a local community network, agencies all knowing each other, whether you're government, people sector, whether you're religious organization, corporates who want to come on board, informal groups who want to play a part, but doing so in a coordinated way through the SSO who understands the landscape, able to galvanize the data, each and every node in that town with training, with kind of relationship building, all aligned to say that, well, yes, I'm doing my job, but in understanding my client's needs, I understand the broader landscape of their challenges, and I'll bring in my relevant partners to make sure that we work together as far as possible. And within each of these community networks, you have your local LCN pilots, you have your comlinks, all working and plugging into the same motherboard or way of doing things, and that motherboard is the case map. So let me now move on to youth offenders. Community support that I spoke about earlier is also important to break cycles of offending for young people. And so upon discharge from our MSF youth homes, young people may reoffend for various reasons: mixing with bad company, difficult family circumstances, and so on. But every young person matters, and we will do our utmost to help them overcome their challenges. So let me share the story of Jervin. Jervin is a young man currently serving national service. He was discharged from the Singapore Boys' Home last year. And it is not easy to adjust back into the community after some time away. Jervin's caseworker understood this acutely and went the extra mile. She checked in regularly on his progress for 6 months after his discharge, helped arrange his NS checkup for enlistment, and connected Jervin's family with the Family Service Centre or FSC for additional support. Jervin was also placed on the Better Barista Holistic Training Program and received his professional barista certificate before he started national service. His social worker and I are both proud of Jervin, and we hope that he continues his good progress. To better support young people like him, after their discharge from MSF youth homes, we have decided to lengthen post-care support from 2 months to 1 year. Post-care officers in the community will therefore have a longer runway to build rapport and a relationship and help link young people to community groups such as schools, employers, interest groups, and other local community partners to help keep them meaningfully engaged and envelop them with positive support and positive influence. And if issues arise, they can help these young people manage and resolve them early. The nature and intensity of support will be tailored to the needs of these young people, and those with additional needs will be referred to partner agencies for support. In fact, if you speak to youth work agencies, youth workers, and youth at risk, including those who have emerged from the crisis, they'll share with you that relationship is critical. And if you ask them to work with one youth worker in one agency, and then say, well, the program is over, go to another program in another place, and have another youth worker, that relationship is just very hard to rebuild. And if you push them from pillar to post and say, well, there are multiple people involved, it will be just very difficult to break through sometimes that barrier, that wall that they put up around themselves. And so this work of lengthening post-care builds on the work of NCPR, the National Committee on Prevention, Rehabilitation and Recidivism. And Mr. Melvin had asked for an update on this work. We will help our youth reintegrate more smoothly into the community and reduce reoffending. We are also strengthening statutory protection for children and young persons. Ms. Silver Lim asked about the timeline of proposed changes to the age for protection under the Children and Young Persons Act, or CYPA. We are currently consulting stakeholders on the proposed amendments, some of which are substantive, and we look forward to Ms. Lim's inputs as well. It is important to ensure that our partners are equipped to play their roles and not unduly rush implementation. Our public consultation will run until mid-March, and we aim to table the amendment bill in Parliament later this year or early next year. Sir, close partnerships between the government and community is crucial to tackle yet another serious social challenge, which is homelessness or rough sleeping. Both Mr. Seah Kem Ping and Prof. Daniel Goh asked about efforts to tackle emerging types of homelessness, or different types of rough sleeping. MSF works closely with family service centres, HDB and other agencies to coordinate support for homeless persons. Transitional shelters offer temporary accommodation and social support to homeless persons who need intensive support to access stable housing, while welfare homes provide long-term residential care for destitute persons who are unable to support themselves and lack family support. As Mr. Seah Kem Ping and Prof. Daniel Goh have pointed out, some individuals who sleep rough in public places may have homes, but do not or are unable to go home for various reasons, such as conflict with family members, co-tenants, and so on. They may also not be known to social service agencies or have declined government assistance. Over the year, we have stepped up partnerships with community groups who are active in befriending and engaging persons who sleep in public places, so that we can better coordinate and strengthen our outreach to them, better understand the precise circumstances they're in, and then allow us to work with the relevant partners, both local community partners, VWOs and government agencies, to try to resolve this challenge that they face. Mr. Chairman, what the House has heard earlier, and in fact yesterday in terms of the Comlink and LCN work, is that the social services will play a bigger role together with ground government agencies in a coordinated, holistic approach to try to tackle some of the most difficult challenges that complex families face. And by no means will this work be easy, but this work will be intensive, and our social workers and our VWOs will need all the support that they can get. And we cannot transform social service delivery or look forward to achieving this new social service landscape without our partners in the social service sector. And as Mr. Seah Kem Ping pointed out, the demands on the sector are increasing and social needs are growing complexity. So we must grow and develop the sector to meet these emerging challenges and better support vulnerable groups. We will continue to provide resources together with community partners like the Tote Board. Over the years, the Tote Board Social Service Fund, or TBSSF, has supported various social service programs benefiting vulnerable families, children and youths, the elderly, persons with disability, and persons with mental health issues. For example, EPIC, or the Early Intervention Program for Children with Developmental Needs, Family Service Centres, FSCs, for low-income and vulnerable families, and school social work programs for at-risk youth. All these are just some examples of programs that have made a big difference in improving lives. Sustained funding is crucial to ensure that vulnerable groups continue to receive the support they need. It also enables VWOs to focus on delivering services well and expand and develop new programs to serve growing areas of need. It will also place them in a better position to operate in a network environment of social support. So I'm happy to share that the Tote Board has committed $580 million to the Tote Board Social Service Fund over the next 4 years. And this is the largest tranche of funds they've put in since it was set up in 2006. This will benefit many VWOs who serve the community. Beyond funding support, we must also support and upskill our social service professionals and develop their competencies to meet growing and changing social needs. We launched the Skills Framework for Social Service in January this year. This helps our professionals to map out career progression pathways and guide organizations in training and developing their talent in the social services. Mr. Darrell David asked about further efforts on this front. How can we better support our social workers and social work professionals to meet the challenges of today and tomorrow? Building on the framework, we will set up a social service skills future tripartite task force, to coordinate and drive skills development initiatives in the social service sector. The task force will comprise sector professionals. It will include academics, experts, and policymakers. I counted 4, but I still call it tripartite. We will explore further ways to build capabilities and strengthen professional practices. And this includes reviewing the entry and training pathways for social service professionals, ensuring relevance in curriculum, identifying improvements for professional practice, and working on joint projects to strengthen evidence-based practice. Mr. Chairman, I've spoken about our plans to provide comprehensive, convenient, and coordinated help centered around our community networks across the island, and also our efforts to strengthen our social service networks in every town and community, and to strengthen our social service sector and professionals. Doing this will take time, but we must commit to this if we want to better support and uplift the vulnerable in our midst. And we'll work together with the community to do better, go further, and make a greater difference. But at the same time, we must continue to support and strengthen our families, as families are the bedrock of our society. So now let me address a couple of the cuts that members have raised relating to family. Single-parent families face more difficulties. Mr. Desmond Chu asked if we could extend benefits such as tax reliefs to single mothers. Now, single parents comprise divorced, widowed, and unwed parents. And most single parents are divorced or widowed and enjoy the same benefits as married parents. Today, all Singaporean children receive government benefits that support their growth and development. These include education and healthcare subsidies. Arising from our review in 2016, we extended 16 weeks of maternity leave and the child development account benefits, including the $3,000 first step grant, to unwed mothers and their children. Some benefits, such as the baby bonus cash gift, tax benefits, and housing benefits, are intended to encourage and support marriage and parenthood. Nevertheless, we will continue to see how we can better support single mothers and the children who face challenges. Professor Daniel Goh and Mr. Christopher D'Souza asked if more could be done to support pregnant mothers contemplating abortion in coming to an informed decision with the option of giving up their children for adoption instead. The decision to terminate a pregnancy or carry a baby to term is deeply personal, and we must respect that. But it is important that an informed decision be made. So all women considering abortion are required to complete pre-abortion counseling, where a trained counselor will share on the medical, psychosocial, and emotional aspects of terminating pregnancy. She can only give her written consent to terminate pregnancy at least 48 hours after this session. Those who require further support will be referred to the family service centres or appropriate helplines. MSF and the Ministry of Health will continue to review how to strengthen and enhance the counselling process. Mr. Faisal Manap asked about working elderly Singaporeans. According to the 2018 Comprehensive Labour Force Survey, 27% of residents aged 65 and above were employed. Among those who work, some do so for financial reasons, others do so to stay engaged, some for both. Retirement adequacy is a concern for low-income elderly. We have assistance and support schemes to ensure our seniors age with assurance, and we regularly review these schemes and introduce new ones when required. Much of this has been discussed yesterday at MOM COS and more at subsequent COS in MOH, I presume. But broadly, seniors receive healthcare support through the Pioneer and upcoming Merdeka Generation packages. The Silver Support Scheme and Comcare assistance provide further financial support. And for seniors who continue working, they also receive employment support and assistance through the Workfare Income Supplement, which has just been enhanced, and the Special Employment Credit. And there are options for them to unlock value from their flats, such as the Silver Housing Bonus and enhanced lease buyback scheme. And if they need someone to kind of guide them, support them, and link them to the relevant agencies, our Silver Generation ambassadors and our AIC officers on the ground will lend that support. Ultimately, helping our seniors age gracefully and with peace of mind is also about nurturing communities of care and support within their homes and community, from family members to volunteer befrienders. Sir, MSF will partner Singaporeans to build a caring and inclusive Singapore where we can live with dignity, raise strong families, and take pride in contributing to those around us. Singaporeans need not face life's uncertainties alone, and help is available to better support and uplift these individuals and families. This is possible only with a strong partnership of of individuals, families and the community, the social service sector and government agencies. And this is the essence of our social compact. So let us continue to strengthen the bonds that hold us together as we collectively build a better Singapore and a better social service sector for all Singaporeans.